The chair would like to call the Health Committee meeting to order on November 7th, 2024. We have all members present, so we have a quorum. Do we have any members of the public?
Chair Schaefer, we've had no requests this evening.
Thank you. We have a consent agenda, and do I have a motion? Motion by Johnston, second by Hanson. Any questions, comments? Hearing none, all in favor of the consent agenda, say aye. Aye. Any opposed? Okay, consent agenda is approved. Moving on to departmental matters. First up is Jessica McKnight, Health Department Administrator. You have one item for action. It's a request approval of an ordinance by the McLean County Board amending Chapter 205 fees, Article 11 miscellaneous code fees in the McLean County Code. Motion by Johnston, second by Byrne.
So this is just making a correction to a previously approved ordinance. The factoring for the increase on the previously approved ordinance was based on an incorrectly listed price. So this is just us doing a little cleanup and updating that to what the correct fee will be for 2025.
Any questions, comments? Okay, hearing none, we're going to vote on approving the ordinance for Chapter 205, Article 11 fees. All in favor? Aye. Any opposed? Okay, that's approved. And you have your monthly report.
I do, and would be happy to answer any questions.
Any questions for Ms. McKnight? No? Okay,
Thank
thank
you.
you. Next is Tim Wiley, Nursing Home Administrator, and you have an item for action. It's request approval of the nursing home private pay rate for 2025. Motion by Byrne, second by Hanson. Go ahead.
Hello. These just reflect a 2% increase in our private pay rate, which has been our standard increase for the last couple of years.
Any questions? Did you look at the comparables around town too for that?
I did not.
Okay. Thank you. Anyone else? Okay. Hearing no other questions, we're going to vote on the nursing home private pay rate for 2025. All in favor? Any opposed? And that is approved. And you have your monthly report.
And just prior to the report, a couple things by way of information. First of all, related to the private pay rates, we went ahead without doing any comps because we are planning to engage on a major project at the home next year that will carry on into 2026, and we are going to have to do some census management for that project. We're going to have to empty some resident neighborhoods to allow for the construction work to take place. And at the same time, I'm projecting approximately around a 6 or 7% reduction in our census from what my budget assumptions were. But with the private pay rate increase and by managing payer mix, finding the payers that don't reimburse as well, cutting back on those numbers, emphasizing Medicare census, which pays better, being able to reduce agency utilization and overtime. The plan is that it should be budget neutral for us. So I just want to introduce that information to you related to the private room rates or the private pay rates. And then I was asked to mention to you that yesterday I was voted on to the Board of Directors of the Illinois Nursing Home Association, Nursing Home Administrators Association, so I'll be happy to represent McLean County on that Board of Directors next year. Thank you. And then by way of the report, September seemed to continue our strong trend. You can see the numbers there. The one notable, we were able to decrease our agency utilization by 8% from the previous month, and we're continuing to trend back in that that good direction, that right direction there. And I'm happy to answer any questions that you might have.
Questions from the committee? I really like the treasurer's report. Again, that's, I think we're going to maybe be in the black this year. So that's what I'm hoping for.
We keep pushing.
Anyone else? Okay, thank you. Next is Jason Tabb, Juvenile Detention Superintendent.
Good afternoon. I have no action items for this evening. You should have a copy of my report. I'd be happy to answer any questions if you have any.
Okay, any questions for Mr. Tabb? Okay, thank you.
Thank you.
You get off here so easy every month. Next is Alana Strum, Advanced Correctional Healthcare, and Diane Hughes, Jail Superintendent. And you have one item for action. It is request approval of an agreement between County of McLean and Eric Abreu, DDS. And a motion by Johnston, second by Hanson.
Yes, the agreement is a continuation of our annual agreement. Dr. Abreu's been with us for probably since 2007, so to continue the dental services within the health department, or medical department.
Okay. Any questions, comments? Okay, if not, we will be approving the agreement with Dr. Abreu. All in favor? Any opposed? Okay, and that is approved. And then we have the reports.
Yes, the health services report that Ms. Strum put together. If you have any questions, we'd be happy to answer them.
You have questions?
Just one question. Because the MAR is so new, I was expecting to see kind of fluctuation, and I was just wondering if you could speak to, there was a pretty big decrease. I mean, it sort of peaked two months ago in the report, and it is down significantly. Is that people maybe who have left, or people who've decided this is not going to fit for them? It's not a good fit for everybody, I know that.
We have had people that have left, and I know that Alana and I spoke about that this morning. Okay.
The number has gone down on the, like how many we're administering a month, because now we do the monthly injection. So we still have a lot of people on the program. It's just they only get one injection a month versus a daily administration. Yes.
That makes a lot more sense. But are you like titrating up and then monthly?
Yes, so they do the Suboxone, we do a rapid induction, get them up to the level that they need, and then once they're at that level, we'll do the injection. That way it lowers the nursing load.
Okay, thank you.
Yeah.
Anyone else? I noticed we are now over 50% of the ones that are in the jail have mental health issues. And it's been creeping up, and now we're definitely over 50%. So what kind of impact is that having?
It has a huge impact on everybody's staffing, nursing. Our population is, again, increasing. I believe this morning our count was 211. So prior to the Safety Act, we were, maybe around 230, and then we went down, and we were at some points around 180, but now we're back up to 211. So obviously with the increase of people with especially mental health conditions that are severe and chronic, or who are waiting to go to the Department of Human Services, we have numerous people that are waiting, and they just don't have the beds. So that has a huge effect on staffing and the care that the nurses have to help with as well.
Okay, thank you. Anything else that you want to add? Okay, thank you. Next is Cassie Taylor, County Administrator.
Thank you. As you can see in your agenda, I have no items for action this evening or to present to this committee.
Thank you. Well, under other business and communication, next meeting is December 5th at 4 o'clock. This is my last meeting. This is Mr. Wentz's last meeting, and it's Mr. Knapp's last meeting. So I'd like to thank Mr. Knapp and Mr. Wendt. But I would like to thank the department heads for all the information that you've been able to give us. I've hired two of you, or helped hire two of you. And so I'm very pleased, especially the nursing home, turning that around. The health department, with some of the animosity that was going on for years, I think that we're in a pretty good place. The jail, I think, is really improved, and I think that the JDC, I think that kids are getting the services they need. So I'm really appreciative of you and of your staffs. So thank you very much. And with that, we are adjourned.